Subjective data. Subjective data is data collected by history. If we're collecting the history of a child, that's given to us by the legal guardian or the parent. The adult, you receive that information from the patient themselves. High-risk factors for decay in kids: systemic diseases, compromised immune systems, mouth breathing. The use of xylitol nasal washes can help maintain patent airways in these subjects. Gums bleed when brushing, sweetened medicines, family members with cavities, insufficient fluoride in non-fluoridated areas, deep unsealed teeth, primary and permanent teeth, bottles and sippy cups filled with milk and sugary liquids, high intake of fermentable high-density carbs between meals, raisins, cereals, sugar treats between meals, history of ECC, which is early childhood caries, history of fillings, and irregular dental visits. The risk for adults are slightly different. Systemic diseases, compromised immune systems, mouth breathing, gums bleed when brushing or during orthodontic treatment, white spot lesions or incipient lesions on x-rays, sporadic dental visits, failing restorations, high caries rate in family members, disease, poor dexterity, particularly in the geriatric community, inadequate fluoride use, frequent intake of fermentable high-density carbohydrates, which basically is processed foods, more than 2 cavities in the last year or an active caries process, use of chewing tobacco, xerostomia by itself or with exposed root surfaces, radiation therapy, and pharmaceuticals. The CAT, the CAT, Caries Assessment Tool. One that we use is called a Cavity Risk Assessment Form, the CRAFT form. Let's discuss a little bit now how we collect the subjective data. In our office, we use what's called a Cavity Risk Assessment Form or a CRAFT form. The industry has a form out there called the Caries Assessment Tool. Our objective here is to ask the patients what types of foods they eat, how many cavities they've had, whether the parents have had cavities if we're working with young children. So with that in mind, let's go ahead and look at these tools. Also want you to remind you that these pamphlets and brochures are included in your packet in the manual for you to go ahead and look at closer when you get the opportunity. This is a caries assessment for ages 0 to 5. We have the parent go through and read in column 1 there all the high risk factors. If any of the answers are yes to those questions, then they should be referred to a dentist for a caries risk test and assessment and treatment. The caries risk test, when performed, should be completed on the mother, the primary caregiver, and the child if the child is able to perform the chewing and expectorating. The second part of that form lists protective factors, and you can see they listed there A through F, and you can read those in the manual that's provided. Caries assessment tool for ages 6 years to adult, slightly different. Again, you can read that and get the information that you need at another time. Same procedure. If answers are yes to number 1, then we want to refer to the dentist. We have moderate risk factors in adults and protective factors.